एक मिनट है के
Start.
Good morning, Manu sir. Good morning, VIREN sir, and good morning, Aditya sir. Today I am going to talk about a psychiatric illness such as mania, and thank you for giving me this opportunity to speak my views on such a psychiatric illness. Now, mania. A manic episode is a distinct period of abnormally and persistently elevated, expansive, or irritable mood lasting for at least 1 week or less if a patient must be hospitalized. First is always ask for past history of depression to rule out bipolar disorder. Now symptoms. The patient can't sleep. He or she is mostly irritable with increased amount of energy and distractibility. He or she also present with symptoms such as increased talkativeness, increased amount of activity. And to examine the patient, we use mental status examination. Now here we see the appearance of the patient such as his dressing. He or she is well dressed, in colorful clothes and well groomed. Eye contact is maintained. Rapport established is quickly. Increased motor movements and hand gestures. Gait and posture is erect and normal. Flow of speech and rate is increased. Intensity increased. Pressure of speech is increased. Clarity of speech is clear. Mood is euphoric and expansive. Affect is appropriate. Range is normal. Clarity, coherent. Logical is irrelevant. Formation is flights of ideas. Content, grandiose delusions. And no any disturbance. He or she must be oriented to time, place and person. Attention and concentration, easily distractible. Abstract thinking is present, poor or impaired. Now treatment. There are 4 types of treatment in mania. First is pharmacotherapy, in which we use 3 class of drugs. First is antipsychotic, which is risperidone 4 to 16 milligram, olanzapine 5 to 20 milligram, and haloperidol 5 to 20 milligram. Second is mood stabilizers such as lithium 600 to 1200 milligram, and sodium valproate 500 to 2000 milligram. Third is sedative agents such as benzodiazepine, in which is clonazepam 0.5 to 2 milligram and lorazepam 1 to 2 milligram. And second type of treatment is electroconvulsive therapy, ECT, 4 to 8 sessions on alternative day. And third is psychoeducation, which is for all family members.
Right.
And the fourth one is psychotherapy.
Thank you, doctor. Awesome. Nicely presented this child. Now Dr. Aditya will explain psychiatric as a psychiatrist. Okay.
Good morning, Dr. Manu sir. So today we are going to learn about mania or bipolar disorder, right? So when do we say a patient is manic or has bipolar disorder?
Right.
As Dr. Kaushal mentioned, there are some symptoms which should be present for at least 7 days or less if patient needs to be hospitalized. So in layman terms, if we say there are 2 types of mania, there is either a euphoric type or an irritable type. In euphoric type, patient usually would be very happy, expansile, jovial mood. He would run around, dance, sing.
It's called full-blown mania.
Full-blown mania, right. And the second one is the irritable mania, where the patient may be aggressive. He may try to hit other people. He may try to throw things around. In all of these, there is increased activity, there is increased talkativeness, there is always increased grandiose ideas. Patient would usually say, "मैं तो बहुत मोटा मानस छू, कि मारा पासे बहुत पैसा छे, मारा पासे मोटी जमीन छे." Okay, so this indicates that the patient's ideas, they are very grandiose. Okay, and usually in such cases, in especially types of irritable mania, it is very necessary for immediate prompt treatment to avoid any damages to the patient self or to the people surrounding them. So in any types of mania, earlier the treatment, the better prognosis for the patient as well as for the surrounding people. If we take the surrounding people into consideration, apart from the patient, usually the patient here does not have any insight about any illness. So here the patient is completely okay. He is not troubling as much as the relatives or surrounding people are. So we need to take that into consideration as well, that insight is always going to be poor. So we need to take a proper history from their relatives, what are the symptoms, because patient is always going to feel that he is okay, he is very happy, he does not have any illness, right? The immediate management usually starts with mood stabilizers or antipsychotics as the first line of treatment. We usually start lithium or sodium valproate along with an antipsychotic, usually olanzapine or risperidone. And if necessary, sometimes if patient is very irritable and cannot be restrained, then we usually also take help of injectable antipsychotics like haloperidol along with promethazine. So here, along the issue is the patient does not have an insight. In the initial phases, psychotherapy usually does not play that big of a role. But overall, once patient starts improving, we need to make him aware of the illness, and also we need to make him aware of the initial signs, warning signs, which may that the mania is precipitating, so that he can seek earlier treatment and so it does not go into full-blown mania. We can also psychoeducate the family members regarding the symptoms so that they can diagnose it early, even if they see some change in patient's behavior, and they can prompt immediate treatment so that it does not go into or it does not cause any damage to the patient or the surroundings. If the mania is severe, not responding to treatment, we do have option of giving ECTs, which again has a good prognosis and good role in immediate manic symptoms. Thank you.
Okay, thank you, Dr. Aditya. Dr. Viren sir will say some things. Psychoeducation, whatever.
Okay, so Dr. Aditya sir has wonderfully explained each and everything about bipolar disorder. Now I will explain you about the psychoeducation in the patient as well as the relatives regarding this disorder. Like every disorder in the psychiatry, there are certain stigma associated with this disorder also. And the second issue, as sir already told, like the issue of compliance.
Right.
Generally in bipolar disorder, the first episode required 1 to 2 years of uninterrupted treatment, and in the second episode generally there is 2 to 5 years of treatment. And if there are multiple episodes, or like patient is suicidal, or patient is homicidal, or patient is very aggressive, then lifelong medication may be required in certain cases. And it is difficult for relatives to accept the fact that medicine is required for so much long period of time. The relatives also feel that. See, the bipolar disorder is an episodic illness. So in between the 2 episodes of bipolar disorder or mania or the depression, patient become absolutely fine, like near normal. So relatives feel that what is the need of medication? Why we need to take the medication? But we have to tell them 2 facts. Like the medicine given in that maintenance phase will be low, not as high as which are required in the acute phase. And the second thing, medicines are required to prevent the further relapse. Study shows that if we continue the medication in lower dose for long period of time, there will be decrease in the relapses, because bipolar follow the kindling phenomena like epilepsy. So one episode predict the further episode. So if the number of episodes increase in the bipolar disorder, the chances of further episode will further increase. So we have to stop the episodes in initial part only. Second thing, we have to teach the patient, like 2-3 things are very important in bipolar, like your sleep is very important. Generally we know that all the psychiatric diseases are triggered in the sleep deprivation stage. So we have to tell the patient કે તમારે ઉજાગરા નથી કરવાના, અને જો ઉજાગરાઓ થાય તો એઝ અર્લી એઝ પોસિબલ મીટ યોર ડોક્ટર, તરત મળી લો, કારણ કે 2 to 3 નાઇટ સ્ટેજ ઓફ સ્લીપ deprivation can leads to a provocation of a bipolar disorder. Second thing, do consult a psychiatrist doctor only, because what happens sometimes they go to general practitioner and the relatives use the vague umbrella term of a depression, like patient નું depression ઘણું વધી ગયું છે. What general practitioner think that depression વધી ગયું છે, so they give a more antidepressant, double antidepressant, which is actually triggering the patient. So antidepressant, we must avoid antidepressant during the phase of a bipolar disorder or the mania. So we have to teach the relatives that number 1, medicines may be required for a long period of time. In maintenance phase, medicine required are at the lower doses. Certain investigation required. So many patients and relatives take medicine from pharmacy. They took medicine on their own convenience, which is not advisable, because certain medicines like lithium, which are given in the, as sir mentioned, even in the bipolar disorder, require a constant blood monitoring. So little bit dose increase or decrease can put the patient into trouble. Okay. So there are certain things, and we have to also break the stigmas regarding it's like a biological illness which require treatment. What relatives think that it's external effect, બહારની અસર છે, કે આ બધી વસ્તુઓ પણ મેં બધા
ફેથ હિલિંગમાં જતા હોય છે
અને ફેથ હિલિંગમાં પણ
ઉદ્ભવ અને બધું કરાવે છે.
faith healer but sometimes bluntly say that he doesn't require any kind of medical treatment. Okay. And in certain cases, one threat in bipolar is the chances of suicide. It's not that in depression or schizophrenia only patient commit suicide. In certain cases, 8 to 10% untreated bipolar patient can commit suicide or can commit homicide. So that is also important factor we need to consider. Okay. So I think that's it about the psychoeducation of bipolar.
Thank you, Dr. Viren. Nicely explained.
નમસ્કાર મારા મિત્રો, અત્યારે જે તમે વિડીયો જોયો એમાંથી તમને જે પણ કાંઈ જાણવા લાયક સારું લાગ્યું હોય કે તમે કાંઈક પણ તમારો ઓપિનિયન આપવા માંગો છો તો પ્લીઝ તમે આ કમેન્ટ સેક્શનમાં જરૂર કહેજો અને આ વિડીયોને લાઈક કરવાનું ભૂલતા નહીં અને ખાસમાં ખાસ શેર કરજો મેક્સિમમ લોકોને અને આપણી ચેનલને સબસ્ક્રાઈબ કરજો અને ખાસમાં ખાસ બેલ આઇકોન દબાવી દેજો તો તમને સૌથી પહેલાં ખબર પડી જશે જેવો નવો વિડીયો આવશે ત્યારે. અને ખૂબ ખૂબ આભાર.